Hi, this is Dr. Anuj Shah, the Director of Apex Heart and Vascular, and today I want to talk about all the latest trials and incredible plethora of new data that came out in 2023 in the world of cardiology, especially interventional cardiology. It's been a very promising year. We are learning more and more about overall cardiac conditions. We have a number of new medical therapies, number of new devices, latest trial data, and new technologies helping us taking care of patients in a phenomenal way. So one of my favorite trial this year is about comparing radial versus femoral angioplasty. There was a meta-analysis that looked at 10 trials. We all have kind of known that radial is better for our patients, but this meta-analysis really proved it now again and again that radial interventions and radial angioplasties are much better for patients with a lot less risk of overall mortality and other complications, especially bleeding complications. And the stroke risk, which people were worried, was not significantly higher. So radial is a clear winner. My second favorite is looking at the newer technology, and the biggest one that has come out is lithotripsy. We are using intracoronary lithotripsy balloon now, and that has really negated the need for using complex CSI and some of these atherectomy devices oftentimes, because this lithotripsy balloon is relatively simple to use and we can go after this very calcific complex lesion without needing atherectomy. We are using more and more patients with lithotripsy. There are certain patients in whom we still need rotational atherectomy and lithotripsy. Coined by mentor developed is called rotatripsy, which is a very complex way of dealing it, but now we have a lot of tools in our hand to tackle with these kind of complex coronary intervention. Another new technology that came out is the drug-coated balloon. We have been using it in the lower extremity and peripheral arterial disease patients for a number of years, where we inflate the balloon with the drug elution that comes out. So take all the advantage that a drug-coated stent would have, but we don't leave anything behind. And then now in coronary world, we are getting in the United States for the first time. In the Europe, it exists for the last 6 to 7 years, but in coronary arteries in the US, first time in 2023, there are trials going on with using drug-coated balloon with some promising results. So that's another great technology. Fourth area of advancement is in imaging-guided coronary intervention. We now have a number of imaging tools that we apply along with angiography. So what are some of those tools? Intravascular ultrasound, we've been using it for a while. We are also using OCT, which is optimum coherence tomography, looking at the plaque morphology with these two technology in a phenomenal way. It can define how fibrofatty or calcific the plaque is and what needs to be done to prep the lesion. We also have IFR, which is for a physiological assessment along with FFR. So those are the two tools. We have a physiological assessment of the lesion, and we also have infrared spectroscopy, which also looks at the lesion in a very unique way with the spectroscopy and look at the amount of plaque burden. And there was a yellow 3 trial that came out that looked at role of statin in the patients and how infrared spectroscopy helped with this. So a lot of new imaging guided interventions, and our guidelines are changing, saying that a large majority of this patient we should do some sort of imaging when we are doing coronary artery intervention. There is a number of blockbuster medications that have come out which have shown improvement in mortality. We have a number of new pharmacotherapy for congestive heart failure patients, for patients with hyperlipidemia, antiplatelet, anticoagulation, hypertrophic cardiomyopathy, amyloid cardiomyopathy, etc. In the world of heart failure, we finally have a bunch of blockbuster drugs, most important being Entresto, which is neprilysin inhibitor combined with ARB. And this medication has shown promise on both heart failure with reduced EF and heart failure with preserved EF for what we call systolic and diastolic heart failure. And it's showing improvement in mortality and morbidity and quality of life and reduction in hospitalization. Similarly, another drug called Vericiguat or Verquvo, what we call it, and that one has also shown mortality benefit and has already made it into the class 1 indication in the guideline for patients with reduced EF. SGLT2 inhibitors, which are another incredible medication which has shown a lot of improvement in patients with congestive heart failure and heart failure with reduced EF. So now all these 3 group of medications are in the guideline, and even with low EF, we're automatically putting them on these 3 medications in addition to the beta blocker and mineralocorticoid receptor agents. So 5 medication, class 1 indication for all of these patients. On the lipid side, we have on hyperlipidemia for high LDL, we have a number of new medications. We obviously have statin, tremendous data, over 100,000 plus patient in combined pool of data analysis. But in addition to statin, we have ezetimibe, which still remains second line of choice. But right underneath it, we have PCSK9 inhibitors. We have Praluent and Repatha, 2 medication. Again, number of new data that came out showing the improvement in cardiovascular mortality and morbidity in the right patient population group. We also have 2 new medication, a small RNA inhibitor, inclisiran, which is Lecvia, and then bempedoic acid, which is Nexletol. So these are the 2 new medication with tremendous LDL reduction. The advantage with the Lecvia is it's once every 4 to 6 months injection. So that is another group of tremendous medication coming up. And finally, gene therapy is coming out. CRISPR technology finally approved in certain medical conditions. We already have a medication with CRISPR technology to reduce LDL. So that could actually be game changing as well. So the world of lipidology is dramatically changing, and it's a very promising result. This year we are seeing. The world of cardiology is changing in 2024. We are very excited. Can't wait to see what the new year has to bring. new technologies, new treatment algorithms, new data, new medical therapy, new device therapies, and newer and better ways to continue to take care of our patients. So let's all get together and really work on cardiovascular disease, which still remains the #1 cause of death in the United States, but looking forward to the future, which seems very bright. So from the bottom of our hearts, we wish you a happy and healthy holidays and excellent upcoming new year.